Imagine you're talking with a neighbor, and they mention a recent news article about lead in the local water supply. While discussing the topic further, you realize that this isn't the first time you've heard about contaminated water in your area and its effects. You start to wonder, is my neighborhood making me sick? Unfortunately, it can. Although every community is different, we can address common problems and needs through community health. Community health is an approach to protect and improve the physical and mental well-being of populations by focusing on social, economic, environmental, and other factors that can affect health. Community health strategies aim to prevent disease and reduce health disparities, common but unacceptable differences in health status or health outcomes. As the name suggests, a community health approach engages the people living and working in the community to define the challenges and design solutions to improve their health and well-being and that of their neighbors. Oftentimes, there is already tremendous expertise in the community. A key historical example of the impact of community health took place in China during the 1950s. To address poor access to healthcare and the rise of disease in rural areas, the Barefoot Doctors program educated thousands of farmers on how to provide basic health care to their communities. In about 30 years after its formation, infant mortality decreased by more than 75%, and life expectancy in China nearly doubled. Today, there is growing awareness of the potential that such community health workers can fill in the critical gaps between healthcare systems and communities around the world. So what are the benefits of community health? As opposed to direct medical care, community health contributes to improving the health and well-being of whole areas. Community health works in conjunction with healthcare to try to improve health-promoting conditions in neighborhoods. Conditions like access to healthy foods, healthy environments and green spaces, and education. As a result, it increases the number of individuals who have access to healthcare and who practice behaviors that prevent disease. Community health workers have been instrumental in improving childhood nutrition and preventing and treating childhood illnesses. They are important for distributing crucial nutrients, such as vitamin A, and for identifying and improving the nutritional status of moderate to severely malnourished children in their communities. Given the same cost, community health-based management can treat 5 times more malnourished children than inpatient services. Broadly, community health interventions can reduce the transmission of infectious diseases. In malaria, for instance, community health workers can distribute insecticide-treated bed nets and encourage their usage, accurately diagnose malaria with rapid diagnostic tests, and treat malaria causes with antibiotics. Studies have found that community health workers reduce the overall mortality rate of children under 5 by 40%, and the malaria-specific under 5 mortality rate by 60%. Additionally, community health programs can increase treatment completion rates for tuberculosis compared to facility-based programs, all while providing convenient access to care to patients and their families. In addition to infectious diseases, community health can also help with chronic diseases through prevention and management. One study found that support from community health workers led to improvement in several chronic diseases, such as diabetes and hypertension, and reduced hospitalization. Additionally, the participants in the study had more positive ratings of their mental health and quality of care. By addressing social determinants, community health is a powerful solution to systemic issues we face today. Community health workers are a crucial bridge that connects disenfranchised and medically underserved populations to health and social service systems intended for everyone. Additionally, Community health tends to treat disadvantaged populations which have the tendency to have higher exposure to hazardous waste sites and other environmental pathogens. In remote areas, they may be the only source of health care. Not only do community health workers provide access, but they also play an important role in observing and relaying the realities of their community to those not a part of it. As a result, their work ties directly to social justice. One application of social justice in community health is environmental justice, or the fair treatment and meaningful involvement of all in regard to environmental laws, regulations, and policies. For example, the 16th Street Community Health Center in Wisconsin has addressed the intersection of environmental issues with health since 1997 by restoring abandoned, environmentally contaminated industrial sites and sustainable land use planning. Additionally, the Woonasquatucket River Watershed Council in Providence, Rhode Island, works in collaboration with Black, Indigenous, and other people of color to provide green spaces with safe transportation routes, fresh air, and clean water for the greater Providence community. Both of these models rely on multiple perspectives and input from the local community. As you return to the conversation with your neighbor, it may be no surprise that where you live affects how you live, which includes your health. By considering the social factors that impact disease, community health helps you, your neighbor, and your entire neighborhood to live better lives.